Let's talk about the woman that wants to conceive or that is preparing for conception in 2024. What you should be doing. This is January already. So if you're planning to have a baby this year, now I would advise there are things you need to start doing. It is very, very important. This is because pregnancy has a lot and comes with plenty of things, okay? Now, what I want to talk about is the routine drugs, the normal routine drugs you are taking or you take during pregnancy. And before I go to where I have to hit the nail on the head, I want to tell you what happens during the first trimester of during the first trimester. This is when the important organs are forming. This is when important both genetic and organ, the embryology is taking place. It is very, very crucial. And this is why miscarriage in first trimester, usually you just watch and wait. The highest you can do, maybe give a bed rest or something, because first trimester miscarriage is due to mostly chromosomal or genetic disorders. Do you understand? So this first trimester is a very vital point in pregnancy. Now, coming to when you get into that first trimester, you have all various symptoms, one of them being sickness like nausea and vomiting. And many women may not be able to take their routine drugs at that time. Do you understand? And so some people also may not even know that they are pregnant. Anyway, if you're planning to be pregnant, you should know when you get pregnant, obviously. But people will not know or something. But okay, whether you know or you don't know, first trimester is not very easy for many people. And many people don't want to do anything. And many people say, even when you take the drug, some people, once you take anything, that you pour it out because of how those symptoms are. So I just want to tell you that in your first trimester, it is very, very vital time. However, your body will not even allow you to do what you ought to do. This is why you need to start taking your preconception vitamins before you get pregnant. Now, preconception vitamins, I did not say you should go and buy Well Woman or buy something that is very expensive. Something as cheap as folic acid will play a vital role in your pregnancy as a lady. This is because it is needed during the both the neural tube, the neural case, so the spinal bifida, everything occurs in that first trimester. Now you need this folic acid enough in your body before you even take in, okay? And when you have it there enough in your body and then you take in, you see that some of these diseases like spinal bifida will be avoided, okay? And tend to give birth to a healthy baby. Now, some people are diabetic, and people that are even diabetic, you see that they even need it much more. Or people with different chronic diseases, diabetes being an example, you need to take this folic acid even much more, okay? And start on time to take them, all right? If you cannot take iron, ensure you eat well. You can get iron from meat and vegetables, just plenty of them. Just you eat very well, and we are not bothered about that, okay? Now, people, and for folic acid you can take it throughout your pregnancy, but the most important time is that first trimester, when you can just take start before conception and move until the end of first trimester. If you decide to stop, no problem, even though you will say okay, you can just take it for the throughout the pregnancy. But if you have challenging symptoms during the first trimester but you're taking it on time, you started on time, lucky are you. Did you gain anything in this video? I don't want it to be very long, so I'm going to stop here. Follow me for more. Subscribe to our YouTube channel. Don't forget to share. I remain your girl, Dr. Sustain. I see you in my next video. Bye.